So hello everyone, welcome back to my channel. So today we'll cause of pathological hirsutism in young females. The answer is PCOS. Next, what is the most common cause of since there is increased LH, which is also called as this is also called as tonically elevated LH. Now, for ovulation to occur, we need fluctuating levels of LH, but there is no elevation of LH. There is tonically elevated LH. There is no LH surge. Since there is no LH surge, there will be no ovulation. Since there is no ovulation, what happens? There is no corpus luteum formation. Since no corpus luteum formation, there will be no secretory phase of endometrium. Therefore, there is decreased progesterone and increased estrogen. Therefore, there will be more and more proliferation of endometrium, proliferative endometrium, leading to what? There will be endometrial hyperplasia. Leading to what? Later on, it can lead to endometrial CA. Since there is estrogen, the endometrium is proliferative, endometrium is very thick, and there is unopposed by progesterone, it can lead to what? There can be menometrorrhagia. Next thing, now what is this insulin resistance? Insulin resistance means what? That is, insulin is not able to function, leading to what? Leading to compensatory hyperinsulinemia. Now, what is the most common cause of this insulin resistance? The most common cause of insulin resistance is obesity. So what happens? This compensatory insulinemia, there is increased insulin, and insulin like growth factor 1. Their receptors are present in the ovarian stromal cells. Now what does they do? They stimulate the ovarian stromal cells to produce more androgen. So now we can know why these androgens levels are increased, as we said that androgen is raised. Now what happens? This insulin, what does it do? This insulin also inhibits hepatic synthesis of SHBG. What is this SHBG? This is sex hormone binding globulin. This is the main carrier protein that binds with testosterone. Now, since this SHBG is decreased, what happens? This testosterone will increase. So the unbound form of testosterone or free testosterone or bioavailable testosterone will increase. So now we can understand why these testosterone levels are getting raised. Now, next we'll move on to another topic, that is Hayran syndrome. Before that, we have to know what is acanthosis nigricans. So this acanthosis nigricans is the reliable marker of insulin resistance in hirsutism. So what is acanthosis nigricans? Acanthosis nigricans is characterized by thickened, pigmented and velvety skin lesions that is most commonly found in vulva, then nape of neck, axilla, below the breast and inner thighs. So this is all because of the insulin resistance in the hirsutism woman. Now next we'll come back again to what is Hayran syndrome. So this Hayran, this is hyperandrogenism, this is insulin resistance, and this is acanthosis nigricans. I hope now this is clear what is Hayran syndrome. Next we'll know what is metabolic X syndrome. This metabolic X syndrome, now some patients of PCOS can develop it in future. So we have to know what is metabolic X syndrome. In this metabolic X syndrome, so 3 out of 5 syndromes should be present. 3 of the 5 following features should be present. Now number 1 feature is abdominal obesity, waist circumference more than 88 centimeters or 35 inches. Number 1. Number 2 is HDL levels less than 50 milligrams per dl. Number 3, BP more than 130 by 85. Next, number 4, fasting glucose 110 to 126 milligrams per dl or postprandial 140 to 199 milligrams per dl. Number 5 is increased triglyceride levels to more than 150 milligrams per dl. So this is all about the metabolic X syndrome. Next is we'll know about the long-term consequences and management of PCOS in our next session. Before this, I would like to wrap up this PCOS. So first we have to know what is PCOS. So PCOS, as we know, the 4 following features: there is obesity, there is hirsutism, there is amenorrhea, and is enlarged ovaries. Next we have to know what is Rotterdam criteria, in which out of 2 criteria should be present. Next is pathophysiology, out of which the 2 basic mechanism is insulin resistance and increased androgen levels. And next we have to understand about Hayran syndrome, and next is the metabolic X syndrome. Thank you.